Good afternoon, everyone. Welcome
Hi.
to our
Hi.
Health Collaborative call. This is Jordana, and I have several of my colleagues in the room with us today, and several of you joining remotely via the phone as well. So, looking forward to this great call. I just want to begin today by going over briefly our agenda for our call today. First, we will begin with attendance and introduction. We'll move into talking about the Be the Change Youth Program. And then we'll continue talking about school integration and continue by providing project updates. So to kick us off, I would just like to take attendance for who is on the call. So I know that many of our sites are actively preparing for their presentations or attendance or in transit to the California School-Based Health Alliance. So you that are presenting, and I hope it's a valuable learning opportunity for those of you that are either planning or attending that conference. So I know that Yvonne from JFK is not on the phone, but how about anyone from Rice Elementary School? Okay, Rice, we'll come back to you. Is anyone on from Roosevelt? Okay. How about San Fernando?
Hi, this is Aurora.
Hey, Aurora, how are you?
How do you?
Okay, and anyone from the Hope Clinic?
Yes, it's Mary Grasker.
Hi, Mary, good to hear your voice.
Thank you.
And I know that neither of the folks from Northwood High School will be able to join, but we'll be listening to the recording after the call and submitting over Basecamp as well. How about anyone from St. Francis? Okay, we'll come back. How about Turner Elementary?
Hi, this is Sarah.
Hi, Sarah. Anyone from Lake Forest?
Jordana, this is Monica. Can you hear me?
Monica?
Hi. Lake Forest might not be in the call. I know they're finishing up the RAPS assessment this week.
Okay. Finishing up the RAPS assessment. Good luck to them on their RAPS assessment, and we will touch base with them afterwards.
Okay.
How about Wakeford? How about Century? And Milwaukee? Okay. And Merlot?
Christina is here.
Christina? Hi. You just arrived from St. Francis, so hello to you. And anyone from Washington?
This is Mandy.
Mandy? Okay, great. Thank you guys all so much for being on the call. And I know that we may have people joining us in a moment or two as lunch meetings end and whatnot. And again, that the California folks are kind of on their way. So we will check back on that in a minute. Monica, I heard your voice. I know that Molly and Juan are preparing for their conference. So good luck to them. Anyone from the Oregon office on?
Hi, Lori's here.
Lori, how are you?
Good, how are you?
Good. And from Maryland.
Hi, Joanna. This is Hoffman.
Hello. Okay, great.
Chelsea's on the line.
Sophie from Whiteboard. Perfect.
Yes. Thank
so
you.
much. Okie dokie. So we'll move forward, and hopefully other folks will be able to join us in a minute or two. I'd like to take a moment to introduce the newest member of the School-Based Health Alliance team. Her name is Natasha. She's sitting right here on my left. and Natasha will be the new program assistant helping with Hallways to Health. So you'll get to know her name, and over time she'll get to know your name, and you'll see some emails from her and be communicating with her. So Natasha, you want to take a moment to let you introduce yourself and tell a little bit about yourself to the Hallways to Health team.
Hi everyone, it's nice to talk with you today. I'm happy to be on this team and to work towards a great cause. I guess a little bit about myself. I came from this area, well, the DC metropolitan area, but I went to school up in Rutgers University in New Brunswick, New Jersey, and I got my bachelor's of science in public health, and ever since then I've been in love with public health, so I have a dedicated fan here, so I'm very happy to be on board.
Thank you so much, Natasha. We're so glad to have you on board. And
somebody can take that one. Just go ahead and eat. I'm on the conference call.
And otherwise, sitting in the room with me is Kara Ann and Selena, and they will be contributing later in the call. I also wanted to give a shout out. If you're on the call, if we can hear a lot of background noise, you could mute yourselves until we can, kind of get the going.
No, I'm using a Tupperware. I'm probably using your Tupperware, so if you want, I'll take this one and I'll take this one. Okay, let's place it there. Let's go.
I wanted to take a moment to congratulate Monica Barnett, formerly Barnett, now Adderley. And you can see some beautiful pictures of Monica's wedding, which happened just a few weeks ago. So Monica, do you just want to tell us a few bits of highlights from your wedding and about the team?
Can you hear me?
Yes, we can hear you.
Okay. It was just a beautiful, beautiful sunny day. It was an outdoor wedding. I didn't worry about the weather on the day of. I guess I didn't worry about a lot of things on the day of. But it was more than I expected. So it was a very wonderful day.
Awesome. We're so glad to hear. We're seeing quite a bit of background noise. So if everyone could take a moment to just your own able to just make sure that you're muted yourself. If someone is calling in on the phone, you should have your own ability to mute if you're calling from, for instance, a cell phone or a landline. And I think that that would really be helpful in minimizing the amount of background noise, and then you could unmute when we're ready to share out. Great. Thank you so much. Okay. I'd like to ask a quick question about if anyone has a story this week where they have had a great interaction with a youth who is involved in the Youth Advisory Committee or through some of the programs and activities that you've been involved with through Hallways to Health. This is an opportunity to unmute your phone if you would like to share.
This is Christina at Merlot. I'm not sure if this is a great example or not, but we rolled out our meditation training this week, and I sat in a room on Monday with 40 students who were all eyes closed in the moment, and they each did a 10-minute meditation. It was the coolest thing to watch as an outsider. It was so exciting, and we did a pre-survey and a post-survey on stress level, and everybody had come in, 6, 7, 8 out of 10, and everybody had a reported lower stress level after the 10-minute meditation. It was fantastic.
Christina, what a great way to kick off your call, to kick off the call, talking about how something that you put into place affected not only one student, but a whole group of students, and to see the immediate visible impact that this workshop and opportunity has on your students is absolutely amazing, and I'm really excited to hear what the students kind of had to say about it afterwards, and I'm sure it was palpable. So thank you so much for sharing. And does anyone else have a story that they'd like to share from this week and interacting with youth? Okay, I'll let you noodle on it for a little bit. So I know that many of you have youth advisory committees or student health advisory committees, and I'd like to take this opportunity to introduce to you my colleague, Selena Moore, who's our program manager for our work with the Bureau of Primary Health Care and responsible for our work with youth engagement, to tell you a little bit more about the Be the Change youth training program that we'll have at our conference.
Hello, everyone. Some of you I know from other things, either met you last year or if you're also were expert people. But for those of you who don't, again, my name is Selena Moore. And thank you so much, Christina, for sharing that story. Those are the exact type of experiences that we love to hear about and be able to provide to students, and then for them to be able to come together at, a set time to share those stories in their own words and to provide feedback to their own peers. And that's really the whole purpose of Be the Change Youth Training Program. For some of you who have been at convention in the past, you may have known that we had a youth track, and we've rebranded it with a new name thanks to our own Youth Advisory Council, who really came up with this concept. And so as you can see on the screen, there's kind of a flyer that shows you what you're really getting out of the program and what youth are coming to learn. And so, they're engaging with each other, they're learning about advocacy, especially given that it's in DC this year and we'll have the rally and Hill visits, and they're learning about the impact that they make both in their school and with their peers, but also how they can do that on a community level, and then most of all, for leadership opportunities. And then you'll see on the right side on the website, under where you go to register for convention, you can also see more information about the program, including the agenda. There's very important, there's scholarships available, because I know that's always a barrier for many, and so we have scholarships available to cover registration and hotel stay for the duration of the convention, and it lets you know how to register, get the waiver forms, any other questions you may have, and it's been a really great experience. This will now be my second time doing it since being with the Alliance, and we had a great time in Austin last year and have an even better program planned for this year. And now I'm actually going to, although I'm not calling her out because she agreed to do this, but if Tosi, if you would just mind sharing from your own experience that she brought a youth last year with her to Austin, and can kind of speak a little to what that meant for him, and what else you could say about the program.
Yeah, so it was, we were in a high school the last 2 years, and we had an initiative in that high school that I oversaw. And as the initiative kind of drilled down, as the grant ended for that program, we felt like the kids could continue doing something health related. And so from the group that we had, we kind of brought the idea about the Student Wellness Ambassador Program. Now, in the school district that we are in, the district have the Student Wellness Ambassador rolled up within their wellness program. And so we found that out, and we proposed the the ambassador concept to the administration of the school, and they embraced it. They allowed us. In fact, the principal did a survey, a needs assessment survey of their school as far as what they needed from the wellness ambassador, or what some of their goals would be for the school. And so we narrowed it to nutrition, physical activity, and then engaging with staff. So really, I wanted to just bring up, so our school-based health center is really elementary and middle, but this is within the high school that we had the initiative. So people that have high school and middle school as school-based health center, this is really great because the students in the school can promote wellness activity. It can be another way of really connecting with the school and being a presence within the school. So the students are a liaison of both the clinic and the school. So for our student that we chose to go, he exhibited some rare leadership qualities, and so we selected him to go to the convention, and he had a fabulous time. They met with it's youth from all over the nation, and they all came together. It was really good seeing them connect, seeing them talk about wellness, seeing them talk about what they had to go back to do within their schools. And so he was really impacted. He was motivated to go back and share ideas, new ideas that he learned at the convention. And really, as a chaperone, because I had to chaperone him, it wasn't much at all to do. It was really, that Selena and her group really took them under their wing, did things together. I knew where he was at all times, even though I wasn't right there with him. And I really didn't worry at all about him. The traveling wasn't stressful. He just, he came along with one of our staff. He was lodged there. So the whole experience was great for him. It was good for our health center. We could go back and show the board. He had a presentation that he did with the board. And so I think it's a great experience, and I think it's really something great if you could, establish one if you don't have one, and if you have one, if you could encourage your youth to come to the convention. I think it's a great experience. He's come back within the school this year. We've had a health fair. We've had a Zumba come in. We have food demonstrations using the ambassador to promote wellness activities within the school. And I'm going to shut up at that. I think I've talked too much as it is. So that's it.
Thank you so much. I mean, that just is one example, and there's even more on the website. You can see, and I believe Zion is one of them quoted as well. You can read past participants' reflections from it. They really do get to learn from each other and realize, wow, I'm not the only one out here, trying to make a difference at my age, for myself and others. And so we really encourage everyone, even if you can only bring one, that's one youth that then can go back and be the ambassador to others. So really hope to see representation from as many of you as possible through your youth at convention.
Thank you so much, Selena, for presenting this opportunity to the Hallways to Health leaders, and thank you so much to Tosi for sharing. Following the call, I will send around this flyer and the link to the website. And if you have any questions, you can contact Selena, and Selena will provide her. I can provide her email in the follow-up email as well.
And the scholarship application deadline is May 27th. So definitely get those in so that you can get some funds to assist you.
Okay, wonderful. Thank you so much. Then everyone can share this opportunity with at least one youth.
Yep.
Okay. Does this look familiar to anyone? It should. So we have been talking about this policy framework for the last few calls, And you will remember that there are multiple different steps that are kind of involved in this policy framework, and the sort of apex of which is working on the development itself. But it involves thinking about and considering all of the other component triangles to be able to get to a policy that is written, enacted, monitored, enforced, and that it's operating kind of effectively. So last time we spoke, we took each of these components, explored them a little bit further. We explored where your school-based health center is on each of these, and discussed some challenges, some considerations about how these related to the work that you're doing, and where it is in the calendar, where it relates to the RAPS assessment, where it relates to some of the triangles that you've been working on. And in order for these components of our policy framework to be put into place, we have to involve others. So governance involves others, risk management involves others, procurement and contract management involves others, the resources involves others, the communication about the policy involves others, stakeholder management involves others. And so as we move through this policy framework, it's important to note that the ability to successfully is contingent on successful integration. And integration is something that we've discussed through your site visit questions. It's something that you've been doing on an ongoing basis in building relationships and building rapport, and in building trust with your partners in the community and with your partners at the school. So to talk about school integration, the School-Based Health Alliance developed these basic school integration principles. So school integration is one of the major core competencies that we have for school-based health centers. And we have further developed this integration piece to talk about the basic principles that integration is made up of. So let's look at these basic principles of integration. And I want to do a little bit of interactive. So Aurora, I'm going to ask you can read these integration principles out to us.
Number 1, implement mutually supportive policies and procedures that support student health and academic achievement. 2, implement school-wide strategies and frameworks that support health and academics and help at-risk students. 3, implement collaborative systems and structures to plan programs and direct resources to at-risk students and their families. 4, implement integrated school health programs and services that support school goals and target student populations of concern. 5, utilize education and health data to drive policy and program development. And 6, engage in joint resource development, including fundraising, business partnerships, and professional development to support priority programs and services.
Great, thank you so much, and thank you for reading for us. So these principles are ideal aspirations of and broad concepts of where we're looking to go with integration. Just a question to the whole group, are there any of them that resonate particularly with you as something you have been working on or something you've been thinking about working on?
This is Mandy, and I can jump in. So in looking at these, one of the things that we did is we established an attendance committee where students that are missing a lot of school, we bring up their names and figure out who's working with them at the school. We're trying to come up with a streamlined system where we can have access to pulling up a student's name and seeing what support staff working with them. And we also closed a loophole where if there's a student that's missing a lot of school and it's perceived that it's due to health reasons, they get connected with our nurse practitioner and or mental health specialist.
Incredible. So Mandy talked about the integrating of the collaborating with the systems and structures piece, and especially focused around attendance. And I know that that's something that Milwaukee is working on, something that Lake Forest has a really good system in place for, and something that Roosevelt is also working on. Great. Any other volunteers to share out? Okay. So it's important to note that these are not necessarily linear. You could be implementing mutually supportive policies and procedures to support student health and academic achievement, and that could be linked to school-wide strategies to support health and academics. Most likely it will be, but it may be separate from thinking about how the programs and services that support the school goals and target student populations of concern relates to the policies and procedures. So Mandy's example for Washington obviously links the programs and services for students of population of concern, the students with the highest rates of absenteeism, and putting policies and procedures in place to be able to address that and support student health and academic achievement. But there may be components that you could be working on kind of independently, and you may be working on one for a period of time and then look to move to another one. But these are all really wonderful goals and ideals, and we have to define a system to operationalize these integration principles. It's essential to be able to do this so that we can integrate successfully and that we can sustain the work. Now, it's interesting to think about the role of Hallways to Health in promoting this integration between the school-based health center and the school, but many of you have also mentioned that it's not only integrating with the school, but integrating with community partners, which is essential to providing a holistic wellness approach for your students. So as we think about integration, know that we're not only talking about your work with the school, but also with the community. So school-based health center integration has several key characteristics. You have the broad principles that we just reviewed, but within each of those principles are the infrastructures and processes that help to drive the outcomes for student success. As we mentioned initially, school integration is one of our school-based health center core competencies. Within that, we have to conceive anticipated outcomes. If we say that we want to implement mutually supportive policies and procedures that support student health and academic achievement, number one, we have to have a structure to do that. We have to have a process in place to achieve it, and we have to know what will change if we have achieved it successfully. So this map helps us operationalize school integration. Structures are something to put the core competencies into place. They might be policies, they might be procedures that we're going to write up. The policy is the what you're trying to achieve. The process is the implementation of the protocol that we put in place. Trainings that you may conduct with your staff, screenings that you may do with your patients, meetings that have to happen, collecting data that has to happen. Are you really doing the teacher orientations that you talked about doing or the outreach that you talked about doing? This piece, the process piece, is the activity or procedure that carries out the structure. It basically says, are we doing what we say we're going to do? And so what? Did you do it? This is basically saying how you did it. So again, the core competency is school integration and looking at each one of those principles and defining which one you want to be working on. The structure is how we're going to go about doing that. And for us, it's going to be through written policies, procedures, and protocols. The processes are going to look different for each of those. And the anticipated outcome, of course, is what are you trying to achieve by putting this into place? If we do all these things, what do you think will happen? If we do it, do we know that each child, for instance, in the example that Mandy gave, that each child who has a high absenteeism rate will have a plan to reduce their absenteeism, and we can look at the end of the year back at that plan and say that this student has indeed reduced the number of absences that they have had, and their academic performance has increased as a result. So this is where integration falls in line with the policies that you're creating. Does anyone have any questions about that? So when I prepare for this, I put out some questions to you guys, especially because if we're thinking about transitioning to the end of the school year, we're at May 5th, Cinco de Mayo, and many of these integration questions are going to come up. The summer is going to obviously change the number of staff who are in the school building and in the school-based health center. It may bring new faculty in the fall. It may bring new school-based health center staff. It may bring an entirely different student body. It may bring a new school administrator. And the beginning of the year is obviously an opportunity to think about planning intentionally about how the year is going to happen. So, for example, Milwaukee High School is planning a summer program to help transition upcoming middle schoolers into the high school kind of effectively. They also conduct a summer visioning retreat in which they involve members of their advisory committee, members of their youth advisory council, and members of their school leadership to participate and help drive the priorities for the school-based health center. And that's a really excellent illustration of a process by which they are integrating effectively. So in looking at these questions, how do you want to be integrated into the school? What do you want the school-based health center to be within the school? What written policies might institutionalize this integration? What areas have you made significant advances in integration? What opportunities are there? What has been an obstacle? And how do you plan for transitions? And the last one is also a little bit thinking about our shift from phase 1 of Hallways to Health to phase 2 of Hallways to Health, and now we're at the end of our year and moving into another year of Hallways to Health. How will you build and maintain and rebuild relationships which may have been strained, or opportunities to create new relationships? So I'd like everyone to take a minute to think about these questions. And feel free to write in the chat box some reactions that you might have to some of the questions. You can pick one question in particular that has been on your mind, or you could pick something that you know that you have done well that you'd like to share with other schools or other school-based health centers.
Well, this is Tosi with Whiteford Elementary, and I just wanted to say, I mean, that the whole, well, not the whole, but you know, we're doing this initiative in order to enhance the presence of the school-based health center within the school. So we have really, we've been able to really engage the school and have a presence within the school. And this is not just from this year. It started from, you know, the very first phase of Hallways to Health, where we we really were able to engage the school staff and administration. This school year, when Jordana, when you mentioned, new staff coming aboard, so we had, a change in staff. We had one of our real core champion, who was the school social worker leave, and so we have a new one. So we had to start all over again with building the relationship with her, and that's coming along pretty well. And just, the school staff are now, when they see my face, when they see faces of some of the staff that work with Hallways to Health, they're able to really see us as being part of the school. A good testimony to that was, when the school secretary, when she introduced me to the new nurse that came in for the school, she was like, "Oh, Miss Harmon, this is our health educator." And so that, to me said that one of the goals, in doing this initiative has really been fulfilled, which is having that presence, having the school really see us as a part of the school, as opposed to where the health center downstairs, where they send the students down, so they're able to recognize that we provide health education within this classroom, which, came about because of Hallways to Health. So I think that, the initiative has really, really helped in that.
That's awesome. Yeah, it's great to hear some anecdotes about that successful integration and how that transition, the new staff hasn't been an impediment to that, but an ongoing component of that. Thank you so much for sharing, Tosi. Mandy, you were talking a little bit about, I think your idea is great. Do you want to share about inviting the school leadership actively to get involved?
Yes. So this year, just they start planning about a year in advance. So they're starting to plan out what's going on for next year. And so just planting the seed that, hey, we'll be around next year. What is it that we can do for you? Because for me, I felt like this year I said, all right, this is what I'm going to do. And I think they always like it when we ask for their input a little bit more. And so that's something that I want to improve upon from my perspective.
Yeah, that's a great example. And I know that our friends at Northwood are really trying to think about how to frame all of their work, and then similar to the attendance policy that you were talking about, and in the language of the administrator and meeting with the administrator to talk about their priorities. I know that that's something that Grace Elementary School is looking to do as well, where the principal has actively said during our site visit that she is looking to provide more social-emotional support to her students, and the school-based health center said, how can we do that, and how can we be involved in providing for your needs? I mean, I think that that's a really great kind of mentality to get around, and one that's, in line with the sort of the visioning retreat. So Sarah, actually, that leads well into what you wrote about, if you could talk about the retreat that you were having.
Yeah, so we're expanding our school-based health centers dramatically and trying to replicate what we've done at Hallways to Health here and all the other school-based health centers. So just trying to be mindful of as we transition and knowing that we have new different employees there, that coming up with like a collective, mission and what our core values are and vision, so that that we can make sure as we're looking at hiring staff and things like that, that they all, feel that those things are important to them as well, so that we get good fits, so that it's not just a job where you come and you go home, but you are trying to integrate into the school and make, population changes and things like that. So.
Great. And yeah, and how would you describe the role of the school staff in that growth that the SBHC is experiencing as well? Like, what design elements are going to be and need to be present in order that the school-based health center continues to be integrated?
Well, and that's, I guess, part of what we, will talk about. I mean, you need to have people who are motivated to get to know the staff, and and I think some of that's simple, like just maybe even eating lunch with the teachers and making sure that you're visible. Some simple things like that. I mean, we have memorandums of understanding or agreement, whatever, with being in the school. But I think some of it's just even just like the little things of and partnering with the administration again, and part of that would be in the mission, of partnering with the administration of what do you need and where can we help, and then being willing to come up with, other plans. Because I think in each school it's going to be a little different as to what they need.
Yeah, absolutely. Aurora, would you like to share out a little bit about some of the ways that you have been showing your visibility within the school to improve some of this integration?
Yeah, so I started in September, and so I haven't really been working at the school for very long. So then one of the first things I did was like partner with the assistant principal, and then so in the beginning, if I wanted to get a message out to staff members, I would kind of send it to him to send it out to everybody else. But through I teach the sex ed courses on campus, and then people got to know me a little bit more. We had the health fair in the beginning of the semester, and then that seemed to help a lot. But what really, and I also send out wellness emails every week as well, like recipes or wellness activities they could do and stress management and so on and so forth. But what really helped us a lot that I've noticed was that we recently had, so we never had a ribbon cutting event. We relocated into a bigger location. It's still on campus, but we have our own building now. And I believe we opened in May. So we never had an official ribbon cutting event. But rather than having a ribbon cutting event, we came up with the idea of having a teacher or San Fernando High School staff appreciation event, and kind of have this open house event at the clinic to kind of show the clinic, remind everybody that we're still here, and give incentives to the staff members to kind of thank them for referring students to us, for trusting us, for so on and so forth. So that the staff members love that. We were able to get custom mugs made, and then we had giveaways and food for them. And then I made sure to introduce myself to all the staff members that were coming. This is a really big school, so there's an enormous amount of staff members, and so a lot of times they were like, "Oh, you're the one that sends the wellness emails." And ever since then, I feel I've gotten more staff to come up to me and ask me feel more comfortable to ask me questions about the clinic, or feel more comfortable as far as partnering us for certain activities or projects that they may have. And I feel now they reach out to us a lot more. In a sense, we have a lot of school partners on campus, so I meet our organization, so Teen Clinic and then Educare and Youth Policy Institute. We usually have at least we meet at least once a week to kind of catch up and see the programs that each of us are having and how we can support one another, and that has really helped.
Awesome. That's great. Yeah, so you're working on the visibility piece in a lot of different ways. I liked how you talked about, first of all, the props to you for offering to lead the sex education classes. I know that that's something you talked about in those visits that the health teachers were really appreciative of, and so it's definitely kind of in that mentality of what is it we can do for you that will and where can we help? So that's awesome. I really like the idea of giving, not only just doing teacher appreciation, but also creating swag and giving that out. So it's a great way of branding and increasing visibility as well. Great. Christina, do you want to talk a little bit about what you've been doing to brand your wellness team at Merlot?
Yeah, absolutely. So at Merlot, we are going through a big transition right now. Our medical sponsor is changing at the health center, and there's a lot of unknowns. And when I came in and sort of, am I part of the health center, am I not? There was just sort of ambiguity about how to frame where my work falls. So we decided, me in conjunction with our chat coordinator, really talked about kind of having the face of the work we're doing really be collaborative and call ourselves a wellness team. So along with the vice principal, the chat coordinator, our outside consultant, wellness consultant who's doing our meditation training, we've gotten a grocery store on board to kind of support the work we're doing right now. So we're really trying to just put ourselves out there as a wellness team. We have pictures on our office door that have our office hours. We have been having every piece of material that goes out has our picture on it, and we call ourselves the wellness team. So it's been, and we've only been really doing this for the last few weeks, but during my office hours, I've had a handful of teachers pop in over the last couple of weeks and say hi, kind of connecting the dots, and that's been pretty exciting. And I really think putting our picture on everything has been really effective. So people are recognizing us and says, who are you again? Why are you here? Since we're both pretty new. So yeah, it's been hopefully during this transition between sponsors and new staff in the health center, we can be the continuity, so people are feeling comfortable and they know us. So.
Awesome. Yeah, that's great. And what a great idea to again, the branding theme, to be doing that and have that branding be part of your process and in communicating with your partners and in advertising your programs and doing your outreach as well. That's really incredible. Would you like to share, you were talking about some of your relationship building and using Mia to help you do some of that relationship building and where that's gotten you?
Yeah, not really far. I'm having
Yes, there's a container for this, or you want to cross like a okay, I think it's a little bit hard to hear you. So what we're going to do is just talk about how your relationship building and you has been helpful and offering everyone in your team the opportunity to come to the Maryland school-based health care convention. Sounds like a great idea as well. Everyone still hear me?
Yes, can you hear me?
Great. All right, thank you so much. While we're thinking about all these great and wonderful examples, I do want to draw our attention a little bit to the third to last and second to last question, and because we've been talking a lot about what some really wonderful things with regard to integration that have happened, but I do want to talk about some of the obstacles to integrating effectively. So is anyone willing to share? We have needed to do so. If you are going to share, please unmute yourself and then share. Can you brainstorm any obstacles that you have had to integrating effectively? Thinking about any of these principles?
This is Brittany from Century School-Based Health Center. And so one of the barriers that we face right now is with our teacher wellness program. So we're able to get the, exercise fitness, the bi-weekly or the weekly exercise fitness classes that we have on pretty well. And we just started during the school day wellness our exercise program, and we're fighting a really big cultural barrier of administrators not wanting not wanting teachers to use their prep time for exercise, while at the same time noting that there's not enough time during their full lunch to do like a full cardio program or a full running program. So we're starting off with walking and hoping that the teachers that have prep time after lunch will be able to join one of the other two programs. So it's something we're kind of dealing with.
So this is a really great question. It seems like why did you select lunchtime as the opportune time to do the wellness activities?
It was the period of time during the school day that the administration was willing to support us in operating in. So we were working under the confines of being a good community partner to our administrative partners in the school, while still trying to meet the needs, because there is definitely a need and interest in the teacher, like the contracted staff, to do exercises during the day and to have exercise programs during the day. So it was kind of the compromise that we made initially to get the program off the ground, because it's the first time that we've ever been allowed to do something like this during the school day.
That's great, and in order to make sure that you maintain your relationship with the administration effectively, who was hesitant to give any time during the school day, you've modified the parameters of the program so that it'll be a little bit less time-consuming and won't conflict with any of the teachers' other responsibilities.
Yes.
Is that cool?
Yes. However, I've learned that many teachers already exercise during the prep time, so there's like that other layer of it's already happening and you know it.
Okay. Okay, does anyone else want to share any obstacles that you've had to integrating effectively? Okay. How about the second to last question? How will you plan for transitions? So we know that there will be transitions. Christina mentioned some transitions in school-based health center staff. Or how have you planned for transition? There have been, over the course of this year, among your sites, there's been a lot of transition. There's been some medical leave, some maternity leave, some new administrators, some wellness programs, changing hands, changing funders, or changing the parameters of what kind of can happen. So as we get to the end of the year and think about especially what you have been successful in doing thus far, how will you plan for transition? So, Mary, I actually want to ask you if you want to talk a little bit about how your staff has helped transition and maintain the robust Hallways to Health program and Hallways to Health work while you were gone, and as we move into the next year, how your team has been helpful in doing that.
We have a very strong core team at Hope Clinic, and they both value and understand their roles. The nurse practitioner, Laura Garcia Chandler, is extremely passionate about this initiative and has been able to elicit strong support both from the clinic staff and also from the faculty at Ray School. One of the things that in particular that we're doing in terms of sustainability, and I'm very concerned about sustainability, and not everything lends itself so readily to that concept, but in our physical activity programs for children that we've implemented after school,
one of the things we're looking at is a train-the-trainer program, so that the folks who are actually providing, we contract with an independent entity to provide the after-school fitness program, and so they're going to train our school district staff who run a separate after-school program so that they can implement the same level of quality exercise program that the fitness trainers have. So was that what you're looking for?
Not exactly, but that was great. I mean, that's thinking about expanding and replicating. I was thinking a little bit more about if you could talk about how you would, or how anyone could jump in and talk about if there's a transition that occurs, a medical leave, a maternity leave, et cetera, what you need to put into place and how you need to put it into place so that there's continuity.
Okay, so I was out for about 6 weeks on a medical leave, and well, I think because we've already been, maybe it was a little bit of luck, really, and I just work with really high-quality, competent folks, and so I think, but we had already a structured plan in place. We knew what our objectives were. We knew what our goals were. We had objectives in place and a process to carry out the programs. So another colleague, Karen Manning, was able to step in and provide leadership.
Awesome. Thank you so much for sharing about that experience. And as we look back, the structures were helpful there, and to how your staff was able to continue to integrate effectively, as well as the processes. So the roles and responsibilities were outlined, and the timeline was outlined. Who was going to continue to do what in the school space. Thank you so much.
I'd like to.
Yeah, go ahead.
Hello. Hello?
Hi, who is this?
This is Gabby from San Diego, Rice.
Great.
Hi, I just wanted, because I know that this question kind of fits very perfectly on our situation here, where I came in February, and without knowing anything about the program or the grant or the grantee. So for me, I feel as coming in and experiencing this whole thing, I think it's good to have, like someone mentioned before, of course there's goals and objectives and procedures and everything that needs to, so that we can continue to sustain this wonderful program of Hallways to Health. I think that when we have this, especially my experience, was to always have in mind that you are leaving, that someone can leave that position, but it's always nice to share, have that person, that educator, share what is going on in the program with somebody else. Like you have this strong team that also knows what the goals are and how it's proceeding, so that at any one point someone can jump in and they know what they're doing, they know what is next, they have those connections, and at least they've been introduced to the staff in the school. So for me, I know that there's another colleague here working with me, and so that's what I'm doing. I'm bringing her in, knowing, even just mentioning, oh, Jordana, we're having this call, and even things like that, so that they know at least somewhat what's going on with the program. I think that's exactly very.
Go ahead, Mary. That's exactly right. I was going to say that I constantly and very consistently have succession planning in mind. And so I look at that a little bit differently than sustainability, so that you're always communicating, meeting with people, and preparing so that whatever work you're doing can be continued whether you're there or not. I mean, the work doesn't revolve around one individual. It's
exactly. I totally agree. And I think sometimes we have a tendency to act as if we're the only ones. that are doing this. And if something happens, anything can happen in one moment. And so we have to allow others to also participate and know what is going on. So, because you always need that relationship with somebody else having to come in and help you, even for one day, you know, that you need to, or be on a call or whatever to take notes. I just feel so strong about that. It's like not even funny. So anyways, I just wanted to share that. I like to bring people in and know, let them know what's going on, so that it's just in any time they can you know, participate as well and know what's going on, especially with the school, the principals, the students. Yeah. So anyways, thank you. Just wanted to share that.
Thank you so much for that, for sharing that out. That's exactly what we're talking about, because it really depends, you know, your work, even as a school-based health center, without being able to talk to the school administration, without being able to talk to parents, without being able to have a cohesive and collaborative team among your staff particularly, and outside, we need to act together to, you know, to work towards improved health and wellness for the students and school employees. So yeah, thank you so much for sharing that. You guys.
And Jordana, this is Tosi Whiteford also, and I think in addition to what has been said, what I have done, and it just came to me as people were sharing, and I think it could be helpful. So I have a big binder, and every communication that comes through for Always to Help goes into that binder from the beginning of this phase, like all the items that has been sent. It's all in the binder. It's in those clear cover sheets, and it's, you know, from the beginning to now, it's in there. And I have another suggestion, is if you could, you know, like save all this information on a thumb drive or in a folder on your computer. I haven't done that. That would be another good thing too. So if someone coming in could pick up the binder and look through it, or go through that folder, or go through the thumb drive, and that's just another idea I'm thinking of.
That's a great idea.
I did the very same thing. I created a binder with all of the content in it, so if anybody needed it for reference, it would be available.
Yeah, that's a great idea. But it sounds like the binder in and of itself would require a lot of time. I know if that transition place wasn't, if a transition plan wasn't in place and someone wasn't in regular communication as part of the team, it could take them a lot of time to get caught up to speed. So it seems that the binder is essential, but having regular opportunities to share with your other team members and your collaborators, for instance, on an advisory committee meeting, on a cost meeting, etc., that maintaining a constant active communication with other stakeholders is also important to sustaining and to transition into continuity. So yes, and.
Yeah, and that's what I was saying, that because that has been said already. So I'm just saying, in addition to that, you know, the binder is more like a supplementary to that core, having that meeting ongoing.
Yeah, absolutely. And let me ask you a question. I know that we have one site that's not on the call, whose health educator is leaving for a graduate program next year, and the health educator works as a part of the positive youth or behavioral health team, and she personally has had a really great relationship with the clinician. So what are other things that the sites that you guys would do to maintain that level of information sharing, of planning, knowing that there might be a personnel change?
This is Gabby again. From my experience, first of all, I think that what you just mentioned, Jordana, is one of the most important things is to go ahead and bring in that person and totally be honest that you are leaving in advance of time, so that someone else can come in and meet those other individuals who are collaborating with the program. I think that that is important, and not to be selfish, because sometimes we think we own this. We don't own it. The program is for the community. We are benefiting because we are employees, but it's for the community. It's for the good of all concerned. And I think sometimes we kind of hold back. But introducing that that new individual who's coming in, or the clinician, to everyone, so that they're welcome, so that they can welcome the staff in the school, can welcome the other new individual to for the new activities and the goals that we're planning to do. So I think that it's important in advance to be honest and say, you know what, this is going to happen, whether it's at surgery, whatever it is that you're leaving for, to go ahead, if you have that in mind, just put it out there, so that there's plenty of time to be introduced to the rest of the team, or even to the staff at school or other collaborators. That's my take on that.
Great. Anyone else have any other suggestions that haven't kind of been mentioned before? Because it's real. It happens. And it takes time to build relationships. And we may be sometimes not as willing to give what we need to give, especially if we've established a personal relationship with another colleague who we felt comfortable working with, et cetera. So anyone else have any other suggestions? Okay. All right. Thank you guys so much. That was a really rich conversation. And of course, it connects, all of this is really connected back to what you have been doing and what you are doing on an ongoing basis, what you've talked about in your site visits, you know, your advisory meetings. And this is a really great opportunity to share some of your and you know, always be thinking about your future opportunities and thinking about these opportunities for improving integration and what you're aiming for and how you're going to go about doing it and operationalizing it. So to that end, we have some school health integration resources. The first one being just again to revisit what the overall school-based health center core competencies are. And all of these are accessible through our website, schoolbasedhealthcenterforall.org. And the next piece that we have is an integration self-assessment. And especially as we're coming to the end of the year, it might be a good opportunity to take this assessment and to work with your team members on your school-based health center team, and to think about the role that you have and the areas which you're struggling with and the areas that you're working towards with your school staff. Yeah. And then there's a rubric below, and there's a worksheet that helps you kind of walk between those two things and give some suggestions as well. So this is a picture on the top is a picture of part of the assessment. Okay, so you see that the principles are all right there, and you kind of make a self-rating. And then there's a rubric that kind of goes through, and you'll see the first line of the rubric and the first principle on the bottom, talking about implementing mutually supportive policies and procedures. And so if you're an emerging, if you're listed as emerging, you're talking about it and you're developing plans and have taken no significant action to make it a reality. If it's developing, you've begun to do it, and support is growing, but changes remain fragile. Some staff approach the task with a sense of compliance. We're consistently developing integration and principles towards integration. Most staff are committed and feel it's an important factor to our collective school efforts to improve the school. And thriving is the practice is deeply embedded in our culture. We regularly review, adjust, and realign this work. The rubric provides examples and explanations for each principle as well. And just as I talked about before, the principles of integration are not necessarily linear. The examples that you see are actually flow across. There's a lot of background noise again, so if you can mute yourself, that would be great. Typically, if you're just calling from a regular phone and haven't kind of entered your name in, if you could mute yourself, that would be
I wanted you to meet my mom, but you're in the room. And then there was kind of people here. No, it was and my grandma was there, my dad was here. I was like,
a lot of background noise. Thank you. Okay, great. So again, the examples that you'll see here are they move across, but they're not necessarily consistent. They're not necessarily attributed to the principal, so they may not be attributed to the principal. Okay.
Oh, that's good.
I apologize, but we're hearing a ton of background noise. We're going to be on for about 10 more minutes. So if you want to take another conversation, or if you're not really present, it's really affecting the whole call. And everyone can hear. Please mute your Okay, thank you. Okay, so I will be sending out, following the call, I will be sending out some of these resources as well, so that you can take a look at them and you can fill them out, and you can incorporate them into some of your visioning retreats as well. Okay? So moving forward,
that's great.
Yeah. I just wanted to provide some quick project updates. First of all, everyone take a moment. I know we've been on the call for a long time, so reach your arms up to the sky and do big shoulder circles, big arm circles, and maybe some small arm circles. We're all sitting in the conference room here doing it. And reach your arms in back of you. And okay, great. I feel better already. So I just want to provide some quick project updates. As you know, we will be having a Learning Collaborative call in June, and it'll occur in the same time, so Thursday, June 2nd, from 3 to 4:30 Eastern. We'll be focusing on social marketing and then potentially social media, which it sounds like a lot of you have been using, and I'm excited to highlight some of your uses of that. Please begin to consider your questions and examples for the call. And then later in June, we will be seeing you in person, which is very exciting. So again, June 26th through 29th is our convention, and we will be having our midpoint meeting on June 26th on Sunday, and it'll be an all-day meeting. So if you have not turned in your registration, or if you have questions about the registration or hotel, please direct them to me. We're in the midst of processing your registrations. And again, if you're looking to stay in the hotel, you know, please do that ASAP. a little bit more about the midpoint meeting. We will be asking you to do storyboard presentations as you have done in the past. Each site will be asked to do a 10-minute storyboard presentation. And we'll be asking you to focus this year on your biggest win this year in terms of creating a culture of health in your school. So some of the things you might look to talk about are your integration principles, which we've been spending a lot of time on today, policy framework and development, and the impact and outcome which you're having. I will be sending more parameters and guidelines about these storyboards tomorrow. Does anyone have any questions? Okay. And last but not least, first of all, thank you so much for participating so actively on this call. It was a really, really wonderful call to be able to hear some challenges and ideas brainstormed, and I really want to thank you because every single site that's on the call shared at least one time, and many of you shared twice or three times. So thank you so much. I also want to take a personal thank you because is your work day in and day out, which has really allowed this grant to thrive. And just this morning, I submitted a first year report of Phase 2 Hallways to Health to Kaiser Permanente. So, yeah. So, and I was able to highlight much of what you've been doing this year and many of the great stories that you have been sharing along the way. So thank you. And of course, thank you for doing the wonderful work that you're doing and for submitting all of your reports and deliverables to me. And, you know, I know that that this question is a big one on everyone's mind. How many days until summer vacation? So we'll leave you with that. Thank you so much and have a great afternoon.
Thank you, Jordana.
Yeah. Good.
Thank you.
Thank you.
Have a great day.
Thank you.
Bye. Bye.
Thank you. Bye.
Bye-bye.